name is Tim Ria here in studio with Digital Health Live at the Summer Summit in San Francisco, hosted at UCSF. Erica Chain, who's the Digital Health Collaborations Lead at Genentech, is my guest today. How are you doing?
I'm doing really well. I hear the buzz of, Digital Health Summer Summit. Can't get better than this.
Yeah, we're in the epicenter of digital health here at UCSF in San Francisco. Last night, we had an amazing kind of pre-party kickoff and panel called "A Doctor, a Patient, an Entrepreneur Walk into a Bar." So, what was happening there, and who was there?
Well, first of all, if anybody said the word big data, you had to take a shot.
Yeah.
But it was the kickoff pre-party in a bar, really novel setting for having a kickoff for a conference, and we really posed the question to our panel and then the attendees. What currently happens when a doctor, a patient, and entrepreneur would walk into a bar together, and then what happens, in the future? What would you like to see happen?
It's a beautiful hotel. I love that space here. It's historic. So we had on the panel is John F. McInally, who's architect for healthcare transformation at Philips Healthcare, and a number of other folks. What were some of the hot potato topics going on?
Well, Andy was there for CEO of Proteus Digital Health, and John is still so he's at Philips. He's still a practicing nurse every Friday in the emergency room. I thought that was really cool. And then you had Pierre from UCSF, practicing cardiovascular surgeon.
And you have an interesting background yourself and how you got into this space.
Yeah, I started in healthcare as a patient. I was diagnosed with a life-threatening brain tumor in 2010, and I saw where technology could easily close a lot of the gaps in my own health story. I went to bed in June 2011, and I woke up in August. I was misdiagnosed, unfortunately, and I always think with better data, could my tumor review boards or could my care teams have made a better informed decision? And it just so happened that the one guy that figured out what I had was at UCSF.
Great. So going back to, let's talk about what you actually do. So you're building collaborations for Genentech.
Yeah, I'm a digital health collaborations lead in informatics. So one of the biggest things, I actually have a call to action for entrepreneurs and companies and startups in the technology space that are introducing data mining and analytic tools into healthcare. So with all of the increasing scope and use of real-world data in our organization and our industry, with the proliferation of wearables, claims data, clinical data, patient-reported outcomes data, we have a collaboration with Patients Like Me. This year, we'll be getting the added molecular omics piece, novel data for us from our Foundation Medicine, HLI, and 23andMe collaborations. So we have a need to find a fit for purpose and get meaningful insights out of that data. So I have a call to action for any startups that are building awesome analytic technologies that can help generate meaningful insights out of the data and revolutionize research.
Small task?
Very small. And only a small and nimble team of 2.
Oh, really? So how do people reach out to you?
They can connect with me on LinkedIn or Twitter. Erica Chain is my handle. On LinkedIn, it's Erica Chain, or shoot me an email at chaine, CHAINE @gene.com, GENE.
Okay. So what excites you the most about this space?
Oh, that patients finally fit into the healthcare system.
Yeah, it's like it's never been about the patient.
No. When I was diagnosed, they talked at me. You, Erica, you have a life-threatening brain tumor in your midbrain. You have to get brain surgery. And at UCSF, it was the first time a care team had taken the time to talk with me. Yeah. So I see this shift in going to a patient-first practice and approach. I know the surgery I had, it was a bifrontal craniotomy with thalamic resection of the midbrain. I know why I had double vision, slurred speech, and no short-term memory. I'm fully recovered 100%, which is nothing short of a miracle. But for me to fully heal, I need to turn my negative into a positive and support others in a meaningful way and transform the healthcare system.
Nice work. Well, you're a lot of fun. So that's Erica Chain. Thanks for being on the show.
Thank you so much.